Alright, in this video we're going to walk through the Dental Trauma Worksheet so you fully understand each part of the worksheet and how it would be used in conjunction with the Dental Trauma Guide. I want you to understand the worksheet because this is what you will use to walk through the actual patient encounter. At the top of the worksheet you will see a place for the patient's name, 5 points to you for getting this part correct. In the top left, you will find the dental trauma checklist. This section of the form is designed to be referenced throughout the procedure. It represents a systematic, step-by-step approach to the appointment. I literally just walk down the list. Step 1, go over the patient's medical and dental history. Never treat a stranger. We want to know the patient's medical condition and explore how it could impact the dental treatment. Use your medical history form or questionnaire for this step and discuss any pertinent positive findings with the patient. In an emergency situation like this, most things would not be a real contraindication to treatment. This is another topic for another day, and you should have a good baseline understanding of oral medicine and treating medically compromised patients. Step 2 is to ask the patients questions about their injury. What questions do you ask? Well, right below the dental trauma checklist, you will find the questions for the patient section. Simply go through a series of 6 questions for this step. Theoretically, you could have the patient fill this section out, but because I do discuss these questions with the patient, I prefer to fill it out myself. Where did the injury occur? For the most part, this only offers an understanding of the environment surrounding the injury, but this could also have legal implications for the patient as well. If a patient is wrongly attacked and injured in the process, they could be seeking future legal actions against another person. As a medical provider for your patient, you could be asked to testify in court, so your notes and documentation of this incident are critical. How did the injury occur? This is a question that could lead you into possible injuries that need further investigation. Maybe there's a lip laceration due to getting hit with a glass bottle. Perhaps the patient was playing baseball and an avulsed tooth was found in the dirt. All clues that could be important for diagnosis and eventual treatment. When did the injury occur? Was it 30 minutes ago? 4 hours ago? When talking about an avulsed tooth, time is essential and affects treatment. Was the patient unconscious? Why is this important? It is actually very important. The patient could have suffered a concussion or brain injury. Some of the patients I have treated after presenting to the ER were cleared by the ER for possible brain injury before being seen by myself. I did not incorporate cranial nerve testing into this form or handout yet, but it could be something you should look into for your patients if they have a suspected head injury. If they report the inability to remember what happened, had nausea or vomiting, they should be referred to the ER for proper medical evaluation. Has the patient's bite changed? Well, this is important because it could indicate anything from a luxation injury all the way up to a jaw fracture. This is a simple question to ask, but it is also an essential question to ask. The patient will know if their bite feels weird. And sometimes you get a patient who has malocclusion and you may not be sure what their bite actually should look like. The last question you're going to ask about the injury is, are the teeth sensitive to cold or heat? You will see sensitivity in situations when the dentin or the pulp tissue has been exposed due to fractures and trauma. Step 3 for the exam, clean the face and oral cavity. This is simple. If you cannot see, you cannot diagnose it. If there's blood all over the lips and intraorally, you need to clean the wounded area so you can clearly see and diagnose it. This can be done with sterile water or saline. This will most likely be uncomfortable for the patient, but just make sure you clearly explain to the patient that you need to see the injured areas to accurately assess what is going on so they can be treated appropriately. The patient is likely amped up from the injury and now they are at one of their favorite places in the world, the dental office. Try to understand their apprehension and be patient with them. A little empathy and a caring attitude will go a long way. But most importantly, communicate. I find that patients are forgiving if you tell them up front about what to expect. Now that you can see, take a good look around the mouth. It may help to ask the patient what hurts or what they have noticed as well. Be thorough. Start extraorally, then move intraorally. Look at the soft tissue and then look at the teeth. Be systematic and detail-oriented. Again, don't be surprised if the patient finds this uncomfortable. Still, communication is critical. You cannot be afraid of some pain. I'm not saying to torture the patient, but you need to diagnose, and sometimes you cannot diagnose without taking a close look and palpating and really checking things out. If you think it will help and makes everyone comfortable, you may even consider anesthetizing the patient for their comfort and then actually finish your examination when they are more comfortable. I've done this technique many times and it does make it easier for everyone involved. You still need to take a good look first so you know where to anesthetize most effectively. Look for fractures, displacements, mobility, and pulp exposures. So looking at the soft and hard tissues is looking for eye-catching areas that seem out of the ordinary. Once you identify the region of concern, you need to look closer and determine the extent of the injuries in specific areas. Having loops and a good light will go a long way and allow you to see more details. Visible fractures or subtle fractures should be identified. Look for teeth that appear to be out of place or possibly moved due to trauma. These will often have bleeding around the gingiva as well. Check the teeth with 2 blunt instruments for mobility. Check for pulp exposures. Once you have identified the section of the mouth that has suffered the trauma and you have documented the extent of the injury that you witnessed visually, you should perform pulp sensibility testing on any suspected teeth that are involved. This means you will be doing cold testing on these teeth. I will usually go 1 or 2 teeth beyond the alleged area of trauma as well. This is a baseline measurement and serves as a reference for future appointments. We will talk later about some of the types of trauma that can result in a transient lack of responses to cold testing. False negatives are a real problem if your endo-ice technique is terrible. Avoid cotton tip applicators because they do not always have enough cotton present to properly hold the cold of the endo-ice. Try to use larger balls of cotton and thoroughly saturate them with endo-ice. I will either spray the cotton until it drips endo-ice or spray endo-ice into a disposable cup and dip the cotton into the cup, wetting the cotton. Place the cotton on the tooth you are testing on the facial and closer to the cervical part of the tooth. Wait for a response. Do not pull it away too soon. Again, communication is key. Tell the patient, I'm going to put something cold on your teeth to check and see if the inside of the tooth, where the blood vessels and nerves are located, to see if it's okay. Your teeth could be a little hypersensitive to the cold, so I want to warn you in advance if this occurs. When I place the cold on your tooth, raise your hand when you feel it, and this will signal me to take the cold away. Some dentists are scared they're going to hurt the patient, so they pull the cold too soon and get an inadequate response. I would argue that once you see the patient start to raise their hand, I would hold it just like a millisecond longer. Vital pulps will be fine if you do this, and the cold will go away. Document if the tooth felt the cold or not and move to the next tooth. Now, I really only do cold testing when I do pulp sensibility tests because it is the most useful test and has a higher number of helpful responses. Typically, during trauma, expect to see either no response or a normal response. Normal responses being they feel the cold and it goes away within 15 seconds or less. It also helps to tell the patient to place their tongue on the tooth after you remove the cold to heat up the tooth a little faster to make the unpleasant cold feeling go away quicker. The next step is radiographs. I like to do radiographs at this point in the examination simply because I find it easier to order or prescribe radiographs once I have taken a look in the mouth and actually know what kind of radiographs I would like. I had worked at a dental practice where it was standard practice to get a radiograph before the dentist took a look at the patient. And many times I found myself ordering additional radiographs anyway. Basically, the efficiency the practice was trying to build in by doing this was not making it more efficient at all. So take a look at the patient first and then order your radiographs of the area you need more information on. In the top right section of the Dental Trauma Worksheet, you will find a radiograph section. There's a lot of radiograph options listed there. Depending on what you visualize clinically and your differential diagnosis, you will order different types of radiographs. Don't be surprised if you order a radiograph and then later determine you want an additional image based on initial findings. Occlusal and periapical films are usually the most helpful for luxation injuries and root fractures. Suspected alveolar fractures or jaw fractures will warrant a panoramic image or even a CBCT if you have it. If the patient has a lip laceration, you may want to get a radiograph of the soft tissue of the lip to rule out possible foreign bodies embedded in the lip. Taking radiographs of the soft tissue at 25 to 50% of normal exposure can help you identify if there are any foreign bodies present in the lip. There's more information in the trauma guide under each diagnosis on what radiographs will be most helpful, and we will cover that in more detail in later videos. There are many reasons to document the injuries with photographs, to include legal reasons, for educating the patient, educating other providers, and for treatment planning purposes as well. I'm not going to go into all the details of how photography can benefit or how to do it in this course, but even taking some images with your iPhone would be better than no images at all. Just make sure you get the patient's consent and document this in your record. The next step in the examination is diagnosis. On the checklist, you will notice that examining the patient, looking for fractures, pulp sensibility testing, radiographs, and photographs, it's all data gathering. You're gathering information in those steps to better understand what has happened. It is always important to not get tunnel vision too soon and label a diagnosis too early without all the information. I will start to create a differential diagnosis during the data gathering. It is important to create a differential diagnosis during data gathering so you can reference the possible diagnosis and choose to gather appropriate radiographs. But once you have all the information you need, it is time to compile that information into an actual diagnosis. For dental trauma, you could have one diagnosis or multiple diagnoses. It really depends on the extent of the injuries. At the bottom of the worksheet, you will find all the most common dental trauma diagnoses. Check the diagnosis and list the tooth or teeth involved on the blank lines. If you're unsure of the diagnosis based on this list, that would be a time to reference the dental trauma guide to help you finalize your diagnosis. We will go into the various types of dental trauma in later videos, but all the information you need is in the dental trauma guide. The last step of the checklist for your trauma patient encounter is to render appropriate treatment. The diagnosis is critical. Once you have the diagnosis, you can simply flip to the diagnosis in the dental trauma guide and it will tell you what treatment is indicated, when you should see the patient for follow-up care, and any special instructions the patient should know going forward. The back of the trauma worksheet contains sections to list any treatment rendered, follow-up care, and special instructions. In the treatment rendered section, I will check the box next to the treatment rendered and fill in any important details necessary. At the top, you will see options for final and temporary restorations and spaces to list the type of materials used. I try to be thorough with this list, and you have many options to choose from. Don't be surprised if multiple of these boxes are checked, and in all honesty, multiple boxes should be checked if you do this correctly. Based on your diagnosis, you will see in the dental trauma guide the recommended follow-up. I check the appropriate box in the follow-up care section for when I plan to see the patient back. There's also a section where I list what I plan to do at those future appointments. Maybe I plan to take more radiographs and do pulp testing again. Maybe I plan to remove a splint. These are just a couple of examples of what could go there, but ultimately this follow-up section is more for your benefit than anyone. This allows you to use this form to go ahead and schedule the patient for these follow-up visits and to schedule enough time to do what you plan to do at those visits. At the bottom of the back side of the worksheet is the special instructions section. You will tell them these things verbally, but you will also send them home with this information as well. Where do you find special instructions? Again, in the dental trauma guide for each diagnosis is the listed special instructions for your patient. When I have the backside of this form filled out, I like to photocopy the backside of the form and send the patient home with the copy. Again, we go over these things with the patient verbally, but it is nice for them to have a hard copy of the information they can reference later if they have questions or forget something. So that is the dental trauma worksheet. Again, on page 1, you have the checklist, which basically guides you through the entire examination process and treatment. All the other sections of the form allow you to either document examination findings or document treatment rendered and any special considerations for the patient. I really hope you find this worksheet useful and that you decide to use it for your dental trauma patient encounters. Again, this is designed to be used in concert with the dental trauma guide. There's no shame in looking things up. I would rather look something up if I was unsure and ultimately be thorough versus not looking it up and missing something. If you have any suggestions or comments about the form, I would love to hear them. You can place those comments down below or email me personally at jason@comprehensivedentist.com. As a reminder, make sure you download the current version of the form. Go to the handouts section of the course for the latest version. If any new versions come out in the future, you will be notified on the website and via email. All right, I'll see you in future videos.